Okay, so for this particular video lecture, we are going over the joints as an extension to what we've already introduced with the bones. When we talk about joints, you can also refer to them as being articulations, and it's simply a way to reference a point where two bones are going to come together. Of the 206 bones that we have in the human body, all of them are going to form a joint or an articulation with another bone, with the exception of one. And that one unique bone is called the hyoid, and that is the bone that you guys have in your throat. It's actually held in place by soft tissue, the muscles at the base of your tongue, but it does not come in direct contact with any other bone. Now, outside of that, for the remaining 205, all of those bones are going to come in contact or link up with at least one other bone in the body. And so where that union takes place, we refer to that as a joint. Now, in the construction of a joint, there are some things that we have to have present because the purpose of a joint is to allow for the possibility of movement. It is to allow for a structure to work in a particular way so that our body is able to support and function the way that we need it to. So the joint is going to have different types of tissue present in order to allow for that connection to take place, and then to have the cushioning that we need to make sure that you don't have bone coming in direct contact with bone. So as we move through this particular packet, that's what we're going to be looking at, the different types of joints that we have, the movements that they carry out or the function that they allow for, and then the overall design of the most common type of joint that we have within our body structure. So I've already mentioned a couple of points on that first page that you guys have. The bottom part just talks about the joints and what they actually allow for. This typically is going to be the location of where you have bone growth. So when we talked about the parts of a long bone, you would have noticed that the epiphyseal plates were at either end of the bone, they were not in the middle, and that is because that is where bone cell production for that increase in length is going to happen. For easier labor, you guys have joints within the hip bone, which are going to actually relax more during the process of labor due to hormones that are present and allow for that space for baby to come through just to be a little bit larger and make the process a little bit easier. Obviously for movement, so that you guys can carry out all the actions that you want to. And then over time, unfortunately, bones do change a little bit, and some of that is just the aging process, and some of that is the damage from the aging process. So we'll take a look at that as we move through the packet. If you guys move on to the second page, it talks about the different types of joints that we have. And there are places in the body where we need to have the joint structure, but we don't necessarily need to get a lot of movement out of that particular place. And so we have immovable joints, which are also known as the synarthrotic joint structure. And the one thing that you have to understand with the joint relationship is that as the amount of movement increases, the amount of protection decreases. As the amount of movement decreases, the amount of protection from that joint is going to increase. So there is an inverse relationship between the amount of movement you have within a joint and the amount of protection that you get from it. So within the immovable joints, one of the places where we would see this is actually in the suture lines or the joints of the bones that make up our skull. And we need to have those individual bone plates, especially at birth. As baby's coming down the birth canal, there's a lot of pressure because there's not a lot of space. And so if those bones were already fused together, the amount of pressure that would be exerted on them could potentially be too much. It would cause them to break or become damaged in some way. So those bones are not fused together during the birth process. And then for many years after we are born, they are not fully fused together. But once they do fuse together, that is going to then allow for them obviously to be very strong and offer a lot of protection to arguably our most vital organ, the brain. From there, we have slightly movable, and this is going to be kind of an in-between. We get more movement in between the joints, but we still get a pretty good degree of protection from that joint. And this would be within our joints that make up our vertebral column, where we would see this particular type of joint present. So you guys have some flexibility, you're able to move, but at the same point, those joints are designed in a way that you are only allowed a certain amount of movement before you're going to become restricted so that you can't damage that spinal cord that is running down the middle of those bones. And then we get freely movable. And with freely movable, very little protection is going to be offered, but you do get a very high degree of movement within those joints. And so this is where a majority of our focus is going to actually stem from, because this is the largest class of joints that we see within the body. So that's where most of our devoted time is going to go today. If you guys move over to the next page, it talks about the synovial joints. And as I already mentioned, this is going to be the most common type of joint that we have within the body, giving you guys a very large range of motion. And you can easily pick out those places where you have a synovial joint within the body. If you think about your wrist, you can go forward, backwards, you can go side to side, you can make circular motion with it. So that would be a very good example of where you have a synovial joint within the body. Within this particular joint, and it kind of starts on the bottom of that page, but it continues over to the next page that talks about the structures that you guys would have within the synovial joint. Now, one of the biggest things that you have to understand with a synovial joint is that it's going to contain fluid, and so we have to have a design to this particular structure that is going to allow us to enclose the area and hold that fluid in the joint itself. So when we talk about the synovial joint and the structures that we have present, the first thing is the synovial membrane that we have that is going to enclose and hold that liquid in place is going to start on one bone, and then it will extend over the joint itself where the two bones come together, and then it will actually end on the opposing bone. So the entire structure is going to span two bones, and the joint itself is going to be in the middle of that whole structure. So where you have the two bones that come together, on the ends of both of those bones, and you guys saw this when you did your bone dissection the other day, you have that pearly white material. It's much brighter than the bone structure itself, but you were able to cut through it if you tried to cut it with a razor blade. Those caps, those bright white end pieces on the bone, that is actually cartilage. And you would find that where you have two bones coming together, that is the pillow, that's the cushion that you have between the two bones so that you don't have bone tissue coming in direct contact with opposing bone tissue. So those cartilage caps you would find on the ends of each of the bones involved with the joint. And then from there, you have the synovial membrane, as I mentioned already. And this is going to be where you have the actual fluid for the joint being produced. So this whole structure is very much like a bathtub would be the best way that I could describe it, or a sink. So you have an area where the water is going to come in or where the fluid would come into the joint. And likewise, you are going to have an area where the old fluid can drain out. And that's because this is a ever-changing structure. It's not just filled with fluid and that fluid stays there for days, weeks, or months. You are constantly bringing in new clean fluid and draining off the old fluid. And so the synovial membrane is responsible for bringing in that new fluid and making sure that the joint is always fresh and clean. And I mean, you can think of what bathtub water looks like or what sink water looks like after you've washed dishes, things like that. After a point, it needs to be cleaned out and flushed. And so that same sort of thing happens within the joint structure itself. So the synovial fluid itself is going to be a little bit more than what water is. It's going to have a thicker consistency. It's not a very thick gel, but it is going to be thicker than water, and that is going to fill all the open space that you would have all within that joint structure. And basically its main job is to reduce friction within the joint, make sure that the structures within the joint are able to glide and move without restriction, and just make the entire process within that joint a little bit easier. Some of the other structures that you would have within the joint structure, if you look there, you have the meniscus and you have the bursa. The meniscus is going to be a piece of cartilage that you have within the joint structure, And again, this is going to act somewhat as a cushion within the entire structure, just to add a little bit extra support. We tend to see these in places where we have a lot of movement and where we also have potential for a lot of impact. Um, the bursa is a little bit different because the bursa is going to be outside of the entire joint itself. So meniscus is going to be a protective kind of cushion that you have inside the joint. A bursa is going to be a protective kind of cushion you have, but this is going to be outside the joint. And if you look at the definition, it talks about it being a small sac that is located between the skin and the bones. So this is not contained within the joint structure. It would be outside that synovial membrane. It would be outside that joint capsule that encloses the entire joint. And so it's a little bit different location-wise. Same purpose as a meniscus, just where you find it is going to be different. And that's why we have the two different names. So they do carry out the same job. They're just found in two different places. If you've heard of somebody that is suffering from bursitis, bursitis is going to be inflammation of those bursa sacs. So from overuse, from irritation, those bursa sacs will swell up, become inflamed, and because of where they're located between the bone and the skin, there's not a lot of space for them in the first place. So if they swell up and become inflamed, they do become very uncomfortable as well, just because of that lack of room and the fact that they're swelling up and taking up more space than what they are allotted. The only other thing that I don't think I touched on there is the ligament. The ligament is a structure that you guys have that holds bone to bone. Tendons and ligaments are different structures, and a lot of times people will use the two terms in place of each other. A tendon is going to anchor a muscle to the bone, and a ligament is going to go from one bone to a neighboring bone and anchor them together. Now, when we talk about tendons and ligaments, one of the things that you need to understand is that it's not a structure that is just stuck to the surface of the bone. This is actually something that is going to arise out of the periosteum. So when we went through the structures of a long bone, we talked about that skin covering that you have over the surface of the bone, and it spans the entire bone. When you get to the ends of the bone, the tissue is going to start to change a little bit, becomes thicker, and it actually transitions into what is going to give rise to a ligament. This allows for the ligament to be much stronger because it is coming out of that periosteum, and it's not just like you're taking a structure and sticking it to the surface of the bone. Our ability to support our bodies would be much lower than what it is if that were the case, because the amount of impact, the amount of weight that we put on our joints is so great that if the ligament was just stuck to the surface of the bone, we would tear them away on a regular basis. And we know that isn't true. You guys are able to carry out a lot of physical activity, withstand a lot of impact, and those tendons and those ligaments hold their structures in place. And that is because they come out of that periosteum layer, and they're not just stuck to the surface. If you move over to the next page, it talks about the most common types of synovial joints that we have, and there are 6 of them that are identified there. The first one talks about the ball and socket joint, and this is very true to its name. On one of the bones that forms that joint, you would have a ball-like structure, a very rounded process at the end of the bone, and on the opposing bone of that joint, you would have a cup-like depression, and the head of the one bone would fit into that cup-like depression, and they would fit together very well. The 2 best places where you have an example of this would be in the hip, where the femur forms a joint with the coxa or the hip bone. You have a very large pronounced head on the end of the femur and a very large cup depression on the coxa, and those 2 come together at that place. The other is in the shoulder with the scapula and the humerus. It is not as pronounced, it is not as big as the one that we have in our hip, but is still a ball and socket joint. It is much easier to dislocate your shoulder because the cup-like depression that holds the rounded part of the humerus is not as deep as what we have within the hip. And I will bring the bones and we'll actually give you guys a chance to see real examples of this. But just to give you an idea of where they're located at in the body. The next one that we have on the list is the condylar joint. And it talks about finding this at the joints of your fingers or in the bones that make up the palm of your hand. The example that I can give you here, it talks about oval and elliptical. So in one of the bones, you would have an oval-like shape, be rounded off kind of like an egg. And in the other one, you would have a rounded kind of cup formation again, but it's going to be broader than what you would see in a ball and socket joint. So it's going to be a little bit larger. It's going to be a little bit more open. It's not going to curve back around so much as what we would see in the ball and socket. The plane joint, also known as a gliding joint, is going to be a location where you have two bones coming together that are almost going to be flat in their surfaces. And these are going to be found in places where you need to have a lot of stability. If you look at the list, it talks about having one in your ankle. And if you think about when you guys have to stand upright, you don't want to have rounded bones in your ankles, because when you try and stand upright, it would be the equivalent of trying to stand on a stability ball. And if you guys have ever attempted to stand on a ball or a rounded object, you know that that's very difficult to keep your balance. So we wouldn't want to see that type of bone structure within our ankles, because every time we stood up, we would have to constantly work to maintain that balance. So in that ankle structure, we tend to see bones that have almost flat surfaces, so that it is much easier for us to stand and stay in that upright position. So that would be a plane or a gliding joint. With a hinge joint, it talks about having a concave and a convex bone structure, and it talks about finding this within the knee and the joint. A hinge joint is going to be structured in a way that you are going to have a very large range of motion in one direction and no range of motion in the other. If you guys think about your arm, you can bend your hand up to your shoulder and you have a large degree of movement when you bend at your elbow. But if you straighten your arm out and you try and take your knuckles back and touch your tricep, you have no range of motion in that direction. Likewise, you can swing your leg backwards and bring your foot up to your backside, but to bring your toes forward and try and use your toes to touch your thigh, again, you have no range of motion in that direction. So that is what a hinge is. Large degree of motion in one way, no motion in the opposite direction. As far as for the bone structure, the convex and concave, again, just indicating that you have two rounded bones that are going to come together in order to form this joint. One is going to round out, one is going to round in. And if you are a visual type learner, just going back to, I am going to give you guys examples. We will go through these so that you guys can see what they actually look like. Pivot joint. With a pivot joint, this is going to be a situation where you have one bone that sticks or stands right up, and then you have another bone that is going to be a ring formation and slide over that bone that is standing up. If best visual that I can give you is if you've ever seen, or if you have one of those paper towel stands that sits on your table or sits on your counter, and you just have a large piece that sticks straight up and you slide the paper towel right over that, that is the structure of a pivot joint. You have one bone that is going to be kind of slender and stand upright, and then there's going to be another bone that just slides right over the top of it. Best example is what we have in our neck that actually allows us to swing our head side to side, and when you shake your head no, that is the pivot joint that you are using to carry out that motion. On the vertebrae, you have, it's called a dens, D-E-N-S, and it sits straight up on the bone, and then you have your other bone structure within the, excuse me, the atlas that is going to slide right over the top of that to carry out that bone motion or that joint motion. The last one that we have is saddle. And saddle talks about having a concave and a convex bone and allowing for movement in two directions. Talks about it's your thumb, and you guys can take your thumb and move it multiple directions, side to side, front and back, because of that bone formation. Now, with the description being convex and concave, sounds very, very similar to what we have seen with some of the other bone identifications. With this saddle joint, the way that these two bones are fixed together, and the reason that it's called a saddle joint is because it has a saddle type design. If you think about a saddle curves in one direction, and then when somebody sits in a saddle, they are going to sling their legs over in the opposing direction. And so convex, concave, when those two come together, that is the saddle type formation. On the other ones where it talks about having a convex concave type shape, that is like stacking bowls. So if you've ever had a bowl, you have one bowl and then you take the second bowl and you set it inside of that. And that is how those two bones are going to come together. So one is going to curve in, the other one curves out, just like nesting two bowls together. So to give you a little bit more explanation as to why we see that convex concave show up in multiple places, it still can be different how the bones are then put together based on their structure. The last 2 pages are joint movements. And typically with joint movements, they are going to have opposing terms. So you're going to move a body part in one direction, but then obviously you want to be able to move it back in the opposite way so that once you get to a certain position, you don't have to hold it for the rest of your life. You can move back to your starting position. So typically when we talk about joint movements, one movement is going to take you away from your normal position, and then the other movement is going to bring you back. With the one exception of the group that I started off with first, the extensions, you do have 3 within that group. So flexion, extension. Flexion is going to be when you decrease the angle between 2 bones. And everybody immediately, if you say flexion, we think about asking a little kid to flex, and what do? They immediately show you their arm and their bicep. But what the movement actually is, in order to show off that bicep muscle, you have to bring the arm up and you are going to decrease the angle between those 2 bones. So the bone of the humerus and the bones that you have of the lower arm, that's what we're talking about. So if our arm was out straight, when we decrease that angle, that is what flexion is. Extension is going to be then taking the arm back out. So it's described or defined as increasing the angle between 2 bones. And we're talking about bones on opposite sides of the joint. So we have those 2 bones and we are increasing that angle. Hyperextension is going to be when you take a body part past its normal position. So if the head rolls back, that's hyperextension. If you take your arms and stretch them back, that would be hyperextension. It's not your normal anatomical position, and so that would refer to hyperextension. Dorsiflexion, plantar flexion refers to the feet. Dorsiflexion would be bringing the toes up, trying to touch your shin, and plantar flexion would be pointing the toes down, pointing at the floor with your toes. Abduction and adduction refer to the limbs of the body. So when you abduct, that is taking it out to the side. So you have your midline, the center of your body, and if you move a body part away from that midline, that is abduction. When you bring the body part back to the midline, that is adduction. So you can take your arm straight out to the side, or you can kick your leg out to the side. That is abduction when you go out, adduction when you bring it back. And that is going to reference, when we talk about moving it away from the midline, that would be your midline down the center of your body. Rotation and circumduction, moving a body part in a circular motion, is just at the point. If it involves the entire limb and you are moving it in a circular motion, you have to then refer to it as circumduction. If you are moving a body part in a circular motion, but it is at an independent axis, so if I were to move my wrist, that would be rotation. If I swing my entire arm, that would be circumduction. So the easy way, even though you're moving them both in circular motions, if it involves the entire limb, circumduction. If it's just at an individual axis, then that is rotation. Second sheet, supination and pronation. Supination talks about having the hands so the palms are forward or up and the thumbs would be away from each other. And with pronation, it is just rotating the hands. So now the thumbs would be pointing to each other or closer to each other. Palms would be facing down. So eversion, inversion typically refers to the feet. Inversion would be placing the feet so that the heels are close together and the toes are pointed out, almost like you're making a V formation with your feet. Inversion would be pointing the big toes towards each other and having the heels kicked out and away. Protraction and retraction, again, we're back to talking about that midline. So straight down the nose, down through the belly button, down to the floor. With protraction, moving a body part forward, that means just kind of, if you stick your chin out, you are moving that away from that midline in a forward direction. Retraction would be then bringing it back down to that midline. So protraction is away, retraction is bringing it back. And then elevation and depression are true to their names. Elevation is when you raise or lift a body part. So if you shrug your shoulders, that's elevation. Depression would be when you drop them back down. So for this week, we are going to change things a little bit. We are not going to have a test mode. There's been some issues with test modes as of late. And because of that, we're going to change the format. So between now and our next class on the 28th, go ahead and watch the video, take notes, bring those notes with you to class, and we will deal with the test modes and the replacement of the test modes in class. So just make sure that you have those notes ready to go.